Now we're quickly trying to look at another type of fracture which could occur in adults and also children. So this is the supracondylar fracture. So we'll try to look at these fractures. So for the supracondylar fracture, of course, you know that it's a fracture around the elbow. So it's occurring around what? The humerus. That's the lower side of the humerus. Okay. So they are common in children, but they're actually rare in adults. Okay. So in children, they're actually one of the most frequent elbow fractures. So they occur about age 5 to 7. So in adults, they occur when there's a high trauma. That's like a high energy hit, you know. So let's look at it in adults. When it occurs in adults, what's up with it? So in adults, we say that it's rare compared to children, occurs more in children. And if you see it in adults, you must actually suspect that there was a high energy trauma, false accident, you can name it. So presentation has to do with there's a lot of elbow pain, there's a lot of swellings, there's a lot of deformities, and limited mobility. You're not able to move that part of the body like you used to. So treatment involves open reduction and internal fixation. They call that the ORIF. So challenges involve difficult fixation due to the anatomy around that place. And later on, even when the person heals up, it comes up with a cubitus varus deformity. Okay, the elbow can become stiff and it can also have contractures. So they also use, the Krishna's wires, the Y shaped plate, and also external fixations. That's basically if you have a fracture that is less stable. Okay, so when it occurs in children now, which is actually more common, it's actually one of the most common elbow fracture in children. Okay, and that's children that are age 5 to 7. And they actually use this system to classify it. If you use this system, you know the severity. So you know the amount of help that such a child will need. So you have the Gartland type 1, which is non-displaced. There's a fracture, but it's still intact. Nothing is pushed away. You have the type 2, which is angulated but hinge intact. You have the type 3 and type 4, which is completely displaced or unstable. These two, everything is completely disconnected. Okay. So complication is for the nerves that are around that side, they could be injured. So you could have nerves injury around that side. Medial nerve, radial nerve, ulnar nerve could be injured. You can also have blood vessels could also be injured. Okay, I can also have issues of you treated the issue, but the bones did not unite very well, leading to a deformity around that place. So you treat sometimes can you not use operation, so you cast. Sometimes you use operation that's close reduction and percutaneous pinning for displaced fractures. Okay, and I think basically that's what we have. So urgent surgery should be brought in if you feel like there's a displaced fracture. That's type 3 and type 4.